Welcome back to Takacs and Barbara Elder Care Law Hour. I'm Tim Takacs, and today we're talking about the issues involving aging, disability, long life, and unexpected illness. With me today, of course, is my partner, Barbara McGinnis.
Hey, I am Barbara McGinnis, and with us in this segment is Dr. Tom Miller from Miller Health Group in Hendersonville, Tennessee. And Dr. Miller has been helping take care of geriatric patients for many years, and today he's going to tell us how he's different from a general practitioner, how he helps take care of families in the community, and what do we need to know when we're picking a doctor for our elderly loved ones. Welcome, Dr. Miller. What kind of patients do you mostly see?
My group mostly sees folks who have a lot of difficulty getting into the doctor. Most of our folks are older, but if they can access their doctor easily or medical services easily, they really don't see us.
Well, it sounds like you make house calls.
Our practice is really based on a variety of types of house calls, yes. We see folks in independent living, assisted living, at home, skilled nursing, and long-term care.
So you actually go out and see your patients along with your members of your team?
Yes, I do.
Every day, huh? Mostly every day.
I'm the only one in the office that's there. I'm only in my office one day a week. The other 6 days I am out seeing folks in their homes and in the facilities.
Wow. So what are some of the unique challenges that come with treating older people?
Organizing care. Of course, being older doesn't mean you're sick. In our practice, most of our older folks have a lot of medical disabilities. And so organizing care, being able to spend time with the patients. In my office practice, or in most office practices, the limit is 10 minutes per patient. With our patients, they generally take 45 minutes to an hour for a pretty routine visit. A complicated visit may take an hour and a half, and so our practice is designed so that we can take that time, if we need to take that time, on our patients. A lot of our patients their spokespeople are actually their families, and so we have to organize the families with them, and some of our patients are still quite independent, but they have a lot to say. Their histories are long, their histories are complicated, right. Their histories are interesting. Mm-hmm. And there's I've never enjoyed myself any more in my 40 years of practice and working in this area.
So do you think organizing care is sometimes what is the ultimate tipping point that takes people into an institutional setting? Is that part of it?
Unfortunately, most folks, as you know, get into facilities because of an event. Mm-hmm. They don't choose it, they don't plan it. And so when they come in with that event, they bring with them a lot of other medical problems, social problems. And so sitting down and being able to spend that hour or two, and then if they need specialist care, then trying to organize getting them that specialist care if they need medications, getting the medications if they need support from social workers, home health, and all of those things take a lot of time to organize, and that's really the biggest challenge. If an older person's very independent, they really don't need us. I mean, there's a 75 or 80 or 85-year-old person who is healthy and active doesn't need me any more than a 40-year-old does.
So the Ruth Garretts of the world are just, as long as she keeps herself active, she's just fine.
I'll probably 2 steps behind her. She is so fast. Yeah,
right.
She is quick. Mm-hmm.
But, I think a lot of people think that assisted living or these group homes, and I don't mean group homes, I mean like independent living facilities and assisted living facilities, that is a mechanism to provide organized care, but really it's a double-edged sword. I mean, sometimes it can be detrimental for someone's overall health, right?
It can be, particularly going into the hospital, avoiding hospitalizations as much as possible, okay, because of problems associated with confusion. The majority of seniors greater than 75 or 80 or 85 will have that confusion in the hospital, and it's really a terrible problem to deal with. It's really terrible. In the assisted living world, the idea is that there's some assistance. What we have found in the assisted living is most people are very debilitated there. Most have advanced dementia, and the level of care is very similar to a nursing home. Most people stay at home independently as long as they can. They rarely go into independent living as a retirement center. Independent living, most folks there are also very compromised.
Right. And so independent living for them means they have 3 meals a day that's prepared for them. They have minimal assistance, perhaps. They have a pull cord if they fall. They have somebody there.
And somebody checking on them once or twice a day, yes.
So people who are living at home, older people who are living at home, are there particular problems, medical problems that you see that may result in either a hospitalization or maybe actually having to leave the home?
Well, one of the biggest problems that we see is that perhaps only 15% of the population can actually afford being in a facility. They, just by nature, they have to be at home. That presents all sorts of problems. It makes the family member have to be available at times if possible. Sometimes we actually see folks at home that are quite confused and demented, that are by themselves a good deal of the day. Fall risk is, of course, huge. And if a person happens to not be seen for a day or so, we do have folks that we see that have been on the floor for 12 or 24 hours.
Oh my goodness.
A lot of tragic things like that. I really think the best place for a person to be is at home. But to be there at home, there needs to be things brought in. And I'm a big proponent of people being at home, of actually bringing in caregivers or oversight folks, and really supporting these families. A good deal of what we do is actually support the families who are committed to taking care of their loved ones. If they need our help, we will help them all the way until the time of the patient's demise, because I think the greatest thing in the world is to see a family member take care of another family member.
So you talked about being real important to stay out of the hospital, if at all possible. So what are the tips to stay out of the hospital?
Well, if you look to see what causes most hospitalizations in our folks, it's almost always infections. Urinary tract infections, we've talked about some, and pneumonias. Our folks really hardly are able to generate what we call an inflammatory response, because that's somehow or another tied into their nervous system. So they oftentimes won't run a fever or have a chill. Their first symptom is a fall. And the chances are about 1 in 5 or 1 in 6 that if you fall, you're going to break something, usually a hip or an arm. And so when we actually evaluate those people in the ER, we find that most of them have urinary tract infections that cause them to become very weak. They don't have symptoms of urinary tract infections. They simply get weak. And so the first symptom is a fall and a broken bone. That's really sort of difficult to keep up with, because they also, people lose their ability to feel that urinary tract infection. There's no burning or stinging. Pneumonias will occur because of silent aspiration, which is very common in the elderly people and people with dementia. And they won't cough, they won't run a fever, they'll just simply become very ill. And when they go to the hospital, they have pneumonias. If they recover from the hospitalization, then almost all of them require going into a skilled nursing facility for 2 weeks to 3 months.
Oh, my.
It disrupts the families terribly.
Dr. Miller, thank you for coming. I wish we could have more time. Perhaps we'll get you back in later. It's time for another break. We have Dr. Miller's contact information and also Dr. Miller's website. When we come back, we will learn more about Alzheimer's disease from Tiffany Cloud-Mann, warning signs, risk factors, and resources for those who have the disease or are caring for someone with the disease. Stay with us. We'll be right back.